Those questions going to Cone Health's Executive Medical Director of Pediatric Services, Dr. Michael Cinoman. During the break, you were telling me that a lot of pediatricians won't be able to give out the shot. I think a lot of parents thought they'd be able to go to their kid's doctor's office and get it. So what do they do instead?
Well, your pediatrician may. That's probably a question you could ask even before the vaccine is approved. But up till now, it's been more challenging to get the COVID vaccine from the state. You have to be approved and fill out certain paperwork. It's been more complicated to store. So it's just not been very practical for pediatric practices or adult practices to manage this vaccine like others that have been around. So I think, having talked to several of the pediatric practices, that they are not currently be administering the vaccine. So I assume the usual commercial, like Walgreens and the places you've been able to go to get vaccinated for adult vaccines will still be available and be able to do this for children. However, as you mentioned earlier, most parents may not want to take their child to Walgreens or CVS, and I don't mean any slight to them. They would be much more comfortable in their pediatrician's office for good reasons, or to be sure that the vaccine's administered by someone who has experience giving it to 5, 6, 7-year-olds. I think, as we all know, unlike older adolescents or adults, sometimes you can't reason with your child as much. They get pretty frightened about getting a vaccine. So Cone Health is going to have the vaccine available in several ways to administer to the community. One will be at what we call the mass vaccination sites at the Greensboro Coliseum, like we did with adults, where we'll literally be able to vaccinate thousands of patients at a time on any given day. And also at A&T University, as well as helping us with a larger site. And there are specific dates and times that will be available. You would go to conehealth.com/vaccine, and there you can anybody can get an appointment. Doesn't matter if you're affiliated with Cone Health, it's free. Very basic information is required, and you schedule an appointment. You cannot schedule an appointment today because we don't know exactly when the vaccine is approved. But as soon as it's approved, those appointment slots will open up on our website, and we'll have people who are trained to give and comfortable giving vaccines to pediatric patients. They'll be segregated from the adults. If children are particularly uncomfortable, there'll be more private areas to give them vaccines. And of course, they'll be able to be observed 15 minutes afterward to make sure they don't have a reaction.
One parent wants to know, can kids with nut allergies get the vaccine? Is that safe?
Yes, they absolutely can. There are very few contraindications to giving the COVID vaccine, but general allergies, and particularly peanut allergy, is not one of them.
What about a penicillin allergy? Someone else wants to know about that.
No, not a problem at all. In fact, most general food or medicine allergies are all perfectly fine. The only contraindication that I'm strongly aware of is if you happen to have an allergy to a very rare chemical compound that is actually in the vaccine itself, which would be extraordinarily rare. There are people who have general reactions after a vaccine. Sometimes it's impossible to know. That's why we watch people for 15 minutes afterward. And some people, again, it's very rare, but they do have reactions. And all our vaccine sites have medication to treat an allergic reaction actually on the site. So the sites are pretty prepared for that.
We've gotten this question a couple of times. What about an 11-year-old that's going to turn 12 soon? Do you give them the kids dose now or wait until they're 12 and give them an adult?
I guess that's a great question. I'm sure we'll stick to the exact rules. So if you're not 12, you're getting the pediatric vaccine. And I'll bet, although I don't know the data, I don't think we've been shared the data broken down by age group, but I think there's very good evidence that the pediatric vaccine, even though the dose is 1/3, mounted an immune response that was exactly as good as it was in adolescents and adults. So I wouldn't worry too much about that, but it's an interesting question.
And quickly, why is the lower dose okay for kids?
Well, because it works. I think the companies that created the vaccines really almost had to guess, and they didn't not want to choose too high a dose, because I think sure they were concerned about some of the common side effects being more predominant, and the children, of course, way less than adults were. So they chose a dose that was 1/3 that, and then tested it, and it worked to be just as effective as the dose that was 3 times as high.
And there's a lot of regulators right now checking to make sure all those facts line up and everything was correct. And hopefully
yes,
we'll learn more tomorrow. If you missed any of this, we're going to put it all up on our website in the Two Wants to Know section. By the way, all of these past Q&As are there, not just this one. So there's tons of great information about the COVID vaccine out there and treating your kids for other issues too. If you have more questions for Cone Health, send them right here. They'll be back next Monday.